Hello, this is John Kanellopoulos, eye surgeon, medical director at the Laser Vision Institute in Athens, Greece, and clinical professor of ophthalmology at the NYU Medical School in New York City, New York. This is our technique. We described it almost 10 years ago, and we have since treated close to 2,000 patients with keratoconus. I'd like to point out, just to bring it to your understanding, that with the Alcon Wavelight topography-guided platform, we can import two types of topographies within the system in order to achieve topography-guided treatment. Of course, all topographic data are converted into elevation data and then analyzed by the treatment computer, and thus becoming a topography-guided treatment. Now, we first started this work using Placido disc-derived topography that then was translated to elevation topography to do these treatments, and this applies in the first publications we had on the subject. But subsequently, this became available with pentacam-derived, Scheimpflug-derived elevation maps. And in this study, we're trying to compare the two experiences. We had traditionally thought that since Placido disc topography is fairly accurate and is irrelevant to corneal opacities or significant irregularities, that it would be better. But this, to our surprise, shows that the Scheimpflug-derived, the pentacam-derived images appear to be better in all modalities studied. And the main modality here is the flattening of keratometry and the increase in cornea symmetry, or spoken differently, the reduction of cornea symmetry, which we feel is the most important indicator of how severe keratoconus is affecting each patient. I hope you find this introduction to our paper interesting. This is a very technical paper, so you probably have to spend some time looking in the data analysis. But this paper looks at a very large number of patients treated Placido disc driven, and also a very large number of patients treated pentacam driven. Pentacam in the Alcon Wavelight language is called an oculizer. It is a converted pentacam to be used as a surgical tool to import diagnostic data into the excimer laser. We used either the 400 IQ excimer laser by Wavelight or the 500 EX excimer laser by Wavelight as well to achieve these topographic guided treatments. I hope you find this presentation interesting, and I thank you very much for your attention. Impressive changes here, preoperative and postoperative on a Athens protocol patient. You can see the dramatic improvement in the surface irregularity indices. And here we're seeing the improvement of several indices before and after keratometry studied here. Again, comparing the Placido disc and the Scheimpflug studied topography-guided treatments that were combined with higher fluence collagen cross-linking, the technique that we call the Athens protocol in treatment of progressive keratoconus in young keratoconic patients. The data are quite impressive in all the parameters studied. Either that it was visual acuity improvement, distance corrected visual acuity improvement, or reduction in keratometry, or improvement of the topometric indices. In all those variables, the Scheimpflug-derived images, the oculizer images did better as a means to drive the topoguided treatment than the Placido disc-derived images. And these are some of the indicative comparisons. Very illustrious statistics involved here with the help of my associate George Asimellis, who's a PhD in physics. We were able to put the definite proof that not only this procedure with very long follow-up gives very effective treatment, but the pentacam-driven ones are better. I thank you very much for your attention.